seeing your clients in ways that are a little bit unusual from how you usually do it. I know myself in private practice that I work in, we're doing a little bit more telehealth and telephone based interventions. I personally am doing telephone counseling with people I usually see face to face, which has its drawbacks for sure. But today I'm going to talk to you about gambling and about our problem gambling clients, and about the co-occurring problems that they generally come to us with, that we often have to address along with the gambling problem. So just by way of an outline, I'm going to talk a little bit about the role of psychiatric comorbidity in gambling disorder, sort of what we see when we're doing either research or clinical work with people with gambling problems, and talk a little bit about how we might approach treatment for some of these co-occurring problems. And for those of you who haven't seen me present before on the webinars, as Robbie mentioned, I'm trained as a clinical psychologist. Most of my career has been both doing clinical work, but for addictions and for non-addiction types of problems, but also doing clinical research. So the approach that I tend to take is to try and understand how we can make research informative and useful for clinicians. So I tend to incorporate research into my talks, but I tend to incorporate it in a way that hopefully is useful. Now, this is where I typically work. I'm at Wayne State University in Detroit, Michigan, and the bottom picture on this slide is our building. I haven't seen that building in about 3 weeks because I'm stuck on the Canadian side of the border in Windsor, Ontario. And so I just get this lovely view of the Detroit skyline. But at the moment, due to the COVID-19 pandemic, the border is essentially closed. So I am coming to you from my son's bedroom in my house in Windsor, Ontario, Canada. So thankfully, borders also don't seem to disrupt Zoom, which is great. So when we're talking about factors that influence treatment outcomes among people with gambling problems, there's a lot of different factors that we might think of. There's motivation, impulsivity, depression, substance use, social support, and so on. A lot of different sort of things come into effect when we're trying to address gambling disorder and gambling disorder symptoms with people who come into treatment with us. This is part of what I study. I study this sort of spectrum of things that affect treatment outcomes. Today, I'm going to focus primarily on factors related to mental health issues that are directly related. I'll talk about depression, talk about substance use disorders. I'll talk about trauma and post-traumatic stress disorder. And to a certain extent, I'll bring in sort of impulsivity and motivation and how they factor into these various psychiatric co-occurring problems that people with gambling disorder often experience. So co-occurring disorders. What we know about problem gambling and co-occurring disorders is that co-occurring psychiatric problems are the rule rather than the exception with people who have gambling disorder. So what that basically means is the vast majority of people who come to see us for care for their gambling problems will have at least one, and oftentimes several other psychiatric conditions that either contribute to the gambling, may have even led to the gambling problems, or at very least make the gambling problems very difficult to address. So what we do know about gambling disorder and comorbidity is that people with gambling disorder have a high prevalence of depression, anxiety disorders, substance use disorders, and higher rates of suicidality than the general population. Problem gamblers with co-occurring psychiatric disorders experience more serious financial, legal, family, social, and work or vocational problems related to their gambling. And it's also true that this comorbidity may also affect what are the appropriate treatment options, and also what is the potential for treatment failure and relapse. And throughout this presentation, I'm going to elaborate a little bit more on each of these points. But the implication is that basically the gambling disorder rarely ever occurs without other significant mental health problems or addiction problems. In some cases, gambling may occur in response to mental health problems, and we'll talk maybe a little bit anecdotally about some of the cases that I've had where this has been primarily the case. Among problem gamblers, it's important to assess psychiatric issues that may be impacting their gambling behavior, because if you don't assess those psychiatric problems, you can't address them, and they may be fueling the gambling behavior. But it's also important that among mental health patients, it's important to assess for gambling problems, because gambling can sometimes be used as a maladaptive coping strategy to deal with things like depression and anxiety. We'll talk a little bit more about that, but first of all, I want to talk about a few different categories of mental health problems that are primarily sort of some of the most significant ones that we see with gambling disorder. First one being depression and mood disorder symptoms. And the graph that I'm presenting to you on this slide is from data that we presented in an article in the Canadian Journal of Psychiatry that was done by my former postdoc, Jamie Lister. And what he did was he looked at depression symptoms and sort of what are other clinical aspects that are associated with higher levels of depression symptoms among problem gamblers. And one of the things that he found, if you look at this graph, the red bars are basically those who had higher levels of depression symptoms, and the blue bars are those who had lower levels or low levels of depression symptoms. And what we can see right off the bat is that depression is more highly represented among female problem gamblers in treatment. So in this particular graph, 72% of those who had higher levels of depression symptoms were women, compared to about 43% of those who were not depressed. Similarly, suicidality, of course, is more highly represented among those with higher depression. So we found that about 36 or 37% of those with higher levels of depression symptoms also experienced recent suicidality, compared to about 6 or 7% of those who had lower levels of depression symptoms. And a bright spot here is that those with depression symptoms are also significantly more interested in seeking treatment. About 37, 38% of those with higher levels of depression symptoms were interested in seeking problem gambling treatment, compared to about 20% of those who had low levels of depression symptoms. So what we're essentially seeing there is that depression could be a factor that drives people to actually want to get help for their gambling problems. What we also know is that depression interferes with recovery from gambling disorder. We know that problem gamblers seeking treatment experience a longer period of time before obtaining at least 3 consecutive months of abstinence from gambling. And that's from a study by David Hodgins and Nadia Gebele at University of Calgary, Alberta. They've done quite a bit of work looking at factors that are associated with treatment outcomes. And they found that depression doesn't prevent people from getting better when they have gambling problems, but it prolongs the process. So it takes significantly longer to get better if you're addressing both the co-occurring gambling and the depression. Now, there are a number of factors that are associated with depression and things, clinically speaking, that we should be looking for with our clients. Bereavement or loss is a major contributing factor. Now, in my practice in Detroit, a lot of the people that I have had an opportunity to work with have been people who have been recently retired. So people in their mid-60s, early 70s, who a lot of whom had developed gambling problems after retirement. They may have been gamblers before, but it wasn't until they were on a fixed income and had a lot less structure in their day-to-day life that they developed gambling problems. I've treated a couple of people who also lost a spouse during this time. And for a lot of people, that became one of the factors that really contributed to the increased gambling, along with loss of various sort of personal roles in life. When you leave your job for retirement, there's often a bereavement with that process as well. So bereavement or loss is something to definitely look for. Age or life changes, again, like retirement is a time, losing a job, losing a marriage, retirement, that sort of thing. Having large debts or large gambling losses, could be associated with depression. And obviously, the things that we want to watch out for are things like suicide risk. And it's important to be able to directly ask a client if you experience, if you feel like they're experiencing hopelessness and depression, to ask them directly, have you thought about suicide, or have you thought about killing yourself as a result of these gambling problems? And to be able to sort of take that information and do a proper risk assessment, and do referrals or whatever you need to do in that clinical situation. Social isolation is also a very important thing to look out for. And I've worked with a number of folks, both people who have lost a spouse or people who have always lived on their own. And one of the things around isolation is it leads to significantly more depression, but it also leads to this sort of sense of, I don't have to answer to anybody. So nobody needs to look at my finances. Nobody needs to look at my bank account. If I keep gambling, then no one's ever going to notice anything. So these are all factors that have contributed to both gambling and depression, but the things we should be assessing. And we also know that the rates of suicide and suicide risk are significantly higher in people with gambling problems than in people who don't have any gambling problems. And in one study that I published some years ago, we actually found that 48% of people with gambling problems had a history of suicidal ideation, and 12% of those folks had attempted suicide related to their gambling at some point in time. So almost half of people with gambling problems say that they have had suicidal ideation. The number could be even higher, because sometimes people will be reluctant to admit to suicidal ideation. And the risk of suicide attempt is actually quite high among the sample too. Now, there are a lot of people who sort of throw numbers around who say X percent of problem gamblers eventually go on to kill themselves. But in fact, we have very poor numbers. We really don't have any good numbers whatsoever to characterize the number or proportion of people who have gambling disorder who go on to die by suicide. There are no good numbers on that. There are about, I think, 2 studies that are psychological autopsy studies that try to get at what are the rates of people with gambling problems, among people with suicide who die by suicide, and those studies are the closest we've come to getting a decent understanding of the relationship between death by suicide and gambling problems. But ultimately, we know it's higher. We don't have a good sense of the actual numbers. Addictions are another really important area to consider when it comes to understanding the relationship between co-occurring disorders and gambling disorders. And for those of you, I think we did a presentation a while ago where I talked a little bit about our changes from the DSM-4 to the DSM-5. And for those of you who aren't familiar, in DSM-4 and before DSM-4, back to DSM-3, gambling disorder was actually characterized as an impulse control disorder, not otherwise specified. So it was in a category alongside of hair pulling and kleptomania and pyromania and intermittent explosive disorders, among other disorders. And with the DSM-5, there had been mounting evidence to suggest that gambling disorder was much more similar to the substance use disorders, so alcohol use disorder, opioid use disorder, tobacco use disorder, and so forth, than it is with these other categories. And there was enough evidence to categorize gambling disorder as the very first disorder to be considered a behavioral addiction alongside the substance use disorder. So now, instead of being an impulse control disorder, gambling disorder is considered an addiction. So we'd expect that gambling disorder to have high comorbidity with the substance use disorders. So most gamblers have at least a history of other addictions. And one of the things that we found in our research and in our clinical work over many, many years is if you take 100 people who have a gambling disorder, you might find 50 or 60 of those people have a history of an alcohol use disorder or a substance use disorder. About 10% of them may currently have an alcohol or substance use disorder, and the remainder will likely have no history of other addictions other than the gambling disorder. And that's sort of how it breaks out. So the rates of other types of disorders is actually quite high. One of the things that we've found more than anything else is that people often have had a substance use disorder or alcohol use disorder earlier in their adulthood or in their adult life or the teenage years, and they've gone into recovery. And it could be years or even decades until the person ends up developing a gambling problem. And part of that is because they may be solidly in their recovery from substance abuse, but they may not realize that gambling also has a lot of addictive processes and kind of get roped into those processes. And we see that happening in a lot of our problem gambling clients that we see. We know that gambling and substance abuse have effects on treatment outcomes, and most gamblers are also habitual smokers. And I'm going to show you this graph here. This is a graph from Nancy Petrie, who did this study. It was a little bit older study, 2005, but it was from a large household survey done by NISAR of almost 43,000 adults in the United States. And so in this household survey, they identified 195 people who endorsed enough symptoms of gambling disorder to have pathological gambling, which is what we used to call gambling disorder in DSM-4 and DSM-3. And what Dr. Petrie was actually interested in was the rates of other types of disorders that among people who have gambling problems. And that's what these light green bars are. And what you'll notice is that over 70%, about 73 or 74% of all people with a gambling disorder have a co-occurring alcohol use disorder. So that's the highest rate that we've identified with alcohol use disorder. As you could see by the next two bars, the vast majority of those folks, approaching 50%, have alcohol dependence. So not just alcohol abuse, but had alcohol dependence. Now again, these are the older DSM-4 criteria, so we don't use abuse and dependence anymore. But it's important to recognize that alcohol use disorder is hugely comorbid with gambling disorder. The other thing I'm going to point out on this particular graph is the very last bar, nicotine dependence. And as you'll see here, almost 60% of people who meet gambling disorder criteria are also nicotine-dependent daily cigarette smokers. And for those of you who maybe don't know what the rate of smoking is among adults in the United States, we're currently at a point where the rate of cigarette smoking is between 15 and 16% of the population. So back in the 1950s, about half of the population smoked cigarettes. And there's been a gradual decline in the rate of cigarette smoking from that point in time to now. So from 50% all the way down to about 15%. And so what we're seeing here is that there's a fourfold greater number of people with gambling disorder who smoke cigarettes than among the general population. And this is really important from a health standpoint, because what we're finding is a lot of times people who gamble, they gamble while they're also smoking cigarettes. Casinos are one of the last places that you can still smoke cigarettes freely and legally indoors. And a lot of folks that we see are in their 50s or 60s or even 70s. And so this is also a time where for cigarette smokers, they start to experience some level of cigarette smoking illnesses, things like COPD or emphysema or even cancers, or at very least sort of breathing difficulties and other sort of factors that decrease their quality of life. So this can increase the chance that they will continue to gamble because they may be limiting the other sorts of activities that they're able to engage in due to physical limitations. So something to consider here is the high rates of smoking, but also the really high rates of alcohol use disorder. Now, just as a guide, as a way to illustrate, I want to present a study that I did. It was actually the very first problem gambling research study that I conducted back in the late 1990s. We published it in 2002. But this was done at our opioid use disorder treatment clinic back in the, like I said, the late 1990s. And we recruited all of our patients who were undergoing methadone treatment at that particular clinic. And we were interested in a couple of things. We were interested in how many of them met criteria for gambling disorder. And we were also interested in whether or not having gambling problems influence their substance abuse treatment outcomes. And so we had half of our sample were men. 90.5% were African American, because that was pretty much consistent with the population of the city of Detroit at the time, and that was our patient population. Average age was just about 50 years old. Average time in treatment was just under 1 year, so we took everybody who had been in treatment, and about 42% were current cocaine users, in addition to users of heroin or other opiates. And what we found was, when we assessed their level of gambling, was compared to people with gambling disorder, non-problem gamblers, we compared people with gambling disorder and non-problem gamblers on substance abuse treatment outcomes. And what we basically found was that 17% of our sample, or treatment sample, met diagnostic criteria for gambling disorder. For pathological gambling at the time, which was actually, and I would say, and another 13% met criteria for what we call problem gambling, which is subthreshold gambling problem. So we had 30% of our sample had some level of gambling problem symptomology. And that was remarkable, because this was a period of time before there were any casinos available in the city of Detroit. There was one casino over in Windsor, Ontario, which was a very short drive away, but it was in another country, and you needed ID to get there, and you needed a vehicle to get over, and so forth. But at the same time, there were very few sort of structured and regulated forms of gambling in the city of Detroit, because there was no gambling in Detroit in casinos until about 2000 and 2001. So a lot of the gambling that went on there was lottery gambling, and also unregulated forms of gambling like dice games and street numbers and so forth. But what we found was almost a third of our sample had some gambling symptoms. We also followed them through treatment for the next 6 months. And what we found was that among people with gambling disorder, a significantly greater proportion of their urine drug screens in treatment were positive for cocaine. And there was also a trend for more positive opioid positive screens as well. So what we found was, for example, among those with pathological gambling, about 53% of their urine drug screens were positive for cocaine, compared to about 25% among the people who didn't have pathological gambling. Similarly, about 52% of these samples were opiate positive for people with gambling disorder, compared to about 38% among those who didn't have gambling disorder. And that's the graph on the left-hand side. The graph on the right-hand side shows treatment dropout. And we found that about 45% of those who had met diagnostic criteria for gambling disorder or for pathological gambling dropped out of treatment after 6 months, compared to about 18% of those who didn't meet criteria with gambling disorder. So we're seeing that having gambling problems interferes with substance abuse treatment. And I'm going to stop there and ask Robbie to throw up question number 1.
Hey, Dave. And you
Hey,
know
Robbie.
what? I didn't get the questions in. I apologize. It hit me right when we started here. So I can pose these to the group. The good news is we're not going to have poll questions. The bad news is I left them out. But yes, I apologize, guys. Okay, so the question is, the greatest proportion of gambling disorder cases are they what? Are they 1, people who are cigarette smokers? Are they 2, they've had an alcohol use disorder? Is it 3, they have depression? Or is it 4, they have a substance use disorder? Good job, Julie.
I see we're up to 65 people now, which is great. I
Yeah.
also see there's a Q&A. I don't know if anybody...
I think Elizabeth was close. We got a 1. Good job, guys. So it's actually two: alcohol use disorder, and that comes from the NESARC study that Dave spoke about earlier. That's the highest comorbid condition, correct, Dave? That we're speaking of with problem gambling and gambling
Yeah,
disorder.
according to the NESARC study, yeah.
Yeah, yeah.
It was alcohol use disorder. I spent a fair bit of time on the alcohol piece, but I also spent a fair bit of time on the cigarette piece on that slide. So that might have confused a person or two.
Yeah, yeah. And I'm sorry to interrupt, Dave. I'm gonna try to put in the other twos as you
Oh,
speak
okay.
here. So
Okay.
if my screen, if it messes up, just let me know. I'm gonna be on mute working behind the scenes here, okay? So,
Okay.
but
Sounds
good
good.
job,
And
everybody, on that
yeah,
first one. Yeah,
and
okay.
I do see a Q&A question,
Yeah.
the question is, are you suggesting a cross addiction? And I would say, to a certain extent, sort of, yeah. I mean, what we certainly found among substance users, if you're at risk of having one type of substance use disorder, you are at greater risk of having another type of substance use disorder. We also find that to be true between behavioral addictions and substance use disorders, and there's actually quite a lot of biological evidence to suggest that the way people with addictions process rewards, for example, is actually quite similar between people who have substance use problems and people who people who uh, have gambling disorder, other types of behavioral addiction types of problems. There's also some evidence of genetic similarities between substance use addiction and behavioral addictions like gambling disorder. So there is sort of some biological research basis to suggest that there are similarities and underlying mechanisms beneath most addictive disorders. And then there's also the anecdotal piece that we do see significant overlap in addictions. So yeah, I'm saying, and people have used that term, use the term trading addiction sometimes. I don't know if that's the right term or if cross addiction is the right term, but we do know there's a tremendous amount of comorbidity among addictions. So hopefully that answers your question. So I'm going to continue, and I'm going to talk now a little bit about trauma and post-traumatic stress disorder and gambling, and in part because traditionally post-traumatic stress disorder and trauma has been highly understudied among people with gambling disorder, and for a long time there weren't very many studies out there looking at gambling disorder and trauma and post-traumatic stress disorder. As a matter of fact, up until sort of the mid 1990s, there were really only about 3 studies, and these 3 studies are summarized here. And these studies were primarily done with male veterans who were in the inpatient residential treatment program at the Brecksville VA Hospital in Ohio, that was kind of the main place where they did post-traumatic stress disorder and gambling work for the early part of the research that we've sort of been involved with. Now, there's subsequently been a little bit of an increase in sort of both post-traumatic stress disorder research and also gambling disorder and childhood trauma research. And there have been a few studies, but first of all, we'll talk about sort of a brief definition of trauma. Trauma is a catastrophic event involving actual or threatened death or injury or threat to the physical integrity of oneself or others, such as sexual violence. The indirect exposure includes learning about the violent or accidental death or perpetration of sexual violence to a loved one. So trauma doesn't have to be about oneself. It doesn't have to be necessarily directly witnessed. Someone can be indirectly exposed to trauma, can be physically harmed or not necessarily physically harmed, but threatened, and all of these things are still traumatic and still experienced as trauma. And so that's when we're sort of our understanding of trauma when we're looking at trauma and gambling disorder. And there's really only a few studies that have actually looked at the association between gambling disorder and childhood trauma or childhood maltreatment. And the first graph I'm throwing up here is done by David Hodgins. Again, I mentioned he's at University of Calgary, Alberta in Canada. This is a published study from about 10 years ago. It was a telephone-based study where they surveyed almost 1,400 people, that included 11 people with gambling disorder and about 70 people who are at moderate risk of gambling problems. And they used a measure called the Childhood Trauma Questionnaire, which is a measure that's used in a lot of studies. And it has a number of subscales, and those are basically a physical abuse subscale, an emotional abuse subscale, sexual abuse, physical neglect, and emotional neglect subscales. And there's also a total score. And what you're seeing here in terms of these bars, you can see the nice sort of gradual increase in each sort of category of abuse. You see it goes from left to right. It's non-gamblers, non-problem gamblers, low-risk gamblers, moderate-risk gamblers, and problem gamblers. We see for every single one of these types of abuse or neglect that people who endorse being a problem gambler have significantly higher scores than any other category. And there's sort of a linear gradual increase based on the amount of gambling risk that a person is experiencing. So what we're seeing is correlationally, there's a significant relationship between gambling symptoms, problem symptoms, and childhood maltreatment. We're also seeing that there are some differences by gender. There was a study by Nancy Petrie and Karen Steinberg that came out in 2005 that used the same measure, the Childhood Trauma Questionnaire, and looked at differences among problem gamblers between men and women. And so in this graph, the light blue bars are the women and the dark blue bars are the men. And what they basically found were that women endorsed had significantly higher scores on the scales reflecting physical neglect, emotional abuse, and in childhood, and more trauma in childhood generally, and tend to be along these lines. So emotional abuse, sexual abuse, and physical neglect. We also have some data from a more recent study, 2006, more recent than the other VA studies from the VA in Ohio, where they asked problem gamblers who are in residential treatment about their experience of childhood trauma. And these were, in particular, this study was all male veterans. There were some women veterans in the study, but it was such a small number. I'm just taking the male veterans in this particular analysis. And what they found was about 60% of those veterans experienced some form of childhood abuse or neglect, with most of them endorsing emotional abuse or physical abuse, and some multiple forms of abuse as well. But what they also found was when they looked at this particular sample in terms of other types of symptoms, when they looked at people who had some level of alcohol dependence or substance dependence, they found that the rates were a little bit higher. In particular, substance dependence, about 70% of them had experienced emotional abuse, about 60% physical abuse, and about 32% sexual abuse. We also see suicide risk is also associated with increased scores on the abuse scales. With people who had experienced a suicide attempt had significantly higher scores, were significantly more likely to endorse the emotional abuse and physical abuse. Now, they weren't more likely to endorse sexual abuse for some reason. I'm not sure if this is just a quirk of this particular sample, but we are seeing that if a person has alcohol or substance use problems, or they've experienced suicide attempt in their past, they are significantly more likely to report childhood trauma experiences, childhood abuse experiences. So there are a few other studies out there. Some of them use the ACEs criteria, so adverse childhood event criteria. And these include things like emotional abuse, physical abuse, sexual abuse, emotional neglect, physical neglect, parental separation, seeing one's mom treated violently, household substance abuse, household mental illness, or incarceration of a family member. And there are a few studies that looked at these ACEs criteria and in relation to gambling. Watson, for example, found that over 78% of past or current people with gambling disorder had experienced at least one adverse childhood event, and that high ACEs exposure was associated with significantly elevated psychopathology. Poole et al. Found that experience of childhood adversity was associated with gambling disorder, but physical abuse for some reason was not. And Roberts also found that childhood trauma was associated with gambling disorder in a large UK sample of men. So we're seeing that across the board. Childhood trauma seems to be associated with the development of gambling problems later on. We conducted a couple of studies. I'm going to present one of them here because I may have an opportunity to present more of them at another time. But one study we published in 2006 in the Journal of Traumatic Stress was assessing post-traumatic stress disorder among outpatient problem gamblers. We had 149 people seeking treatment, and we used a number of different measures I'll sort of explain as we go through. One of the things we assessed was dissociation. Most of you probably know what we mean by dissociation, but just as a refresher, sort of a mental process that causes a lack of connection in one person's thoughts, memories, and sense of identity, or a disconnection between a person's thoughts, memories, feelings, actions, or sense of who he or she is. So it's oftentimes, we see people who go into a casino and they might sit in front of a slot machine and just zone out, and they're only focused on the machine, and there may be lots of people around them, but they may not even have an awareness of their surroundings, of the people around them, in spite of the fact that they are in the casino. So that's one form of dissociation that we tend to see. So we found that most of our folks were kind of in the mid 40s. 34%, or 51 out of 149, met diagnostic criteria for post-traumatic stress disorder. So if more than a third of our sample were outpatients had PTSD, and the rate was higher for women. So it was almost 42% for women, about 26% for men. We'll talk a little bit about the types of treatment, the types of trauma they experienced. This graph basically shows that there were no major differences. It's a little garbled for some reason. Not sure why the numbers are off. There was pretty much a difference between men and women, and also people with PTSD were more likely to be single or never married. But people with post-traumatic stress disorder also had higher problem gambling scores. And they also tended to be more likely to have a parent with a gambling problem. But this is the most important table that I would like you to see here. So you'll notice that these are the different types of traumas that our people with and without post-traumatic stress disorder actually endorsed in this particular study. And of course, not surprisingly, 100% of people with post-traumatic stress disorder endorsed at least one major traumatic experience in their lifetime, because you need that to have a diagnosis of PTSD. But if you look at the column with no post-traumatic stress disorder, you see that almost 84% of those folks who denied having PTSD also had experienced some significant trauma in their life. And the traumas were not insignificant traumas. You'll see, for example, 51% of those with PTSD were sexually assaulted or sexually abused at some point in time, compared to about almost 26% of those who didn't have post-traumatic stress disorder. We see there's a lot of other sort of levels that are high in both groups, like being attacked with a weapon, or being in a natural disaster, or a significant accident or fire, and so forth. So there's differences between the groups in terms of frequency. We still find higher rates of trauma among people without post-traumatic stress disorder. This graph basically just shows that people with PTSD were more likely to have legal problems. They were more likely to have problems with their family, conflicts, and so forth, and not surprisingly, more psychiatric problems. They were also more likely to use gambling as a way to escape from their problems, escape emotionally, and they were also more likely to experience gambling-related dissociation. So they were more likely to be that person to sit in front of the slot machine and zone out. Last couple of slides of data, we also found that people with post-traumatic stress disorder were more impulsive. And for those of you who saw anything that I presented before on impulsivity, you know that impulsivity can be a bigger challenge in treatment. These people who are more impulsive are going to have a harder time reducing their gambling. And they're also more likely to experience dissociation generally in their life, not just while gambling, but in other sort of aspects of their life. So we're seeing high prevalence of post-traumatic stress disorder among problem gamblers. We're seeing that these gamblers have a tendency to experience more mental health and legal and family and social problems, and more likely to use gambling as a way to escape. They're more likely to dissociate. And so these are all factors that could play into how we treat people, because these are factors that a lot of gamblers can relate to. They understand that they use gambling as a way to escape and to zone out. And we can use that to help them to find better ways to cope, for example. So, Robbie, I'm not sure if you're able to jump in with question 2 yet.
Okay, guys, Robbie is ready.
Yay!
I apologize. I had all these excuses ready for everybody. We see that Maria's holding her hand up, but let's get this next polling question out, okay?
Okay.
And it asks, true or false, a large majority of people with gambling disorder have post-traumatic stress disorder. Is this true or is this false? A large majority of people with gambling disorder have post-traumatic stress disorder. And the results are coming in. We're at 65%. So I'll give it, let's do T minus 10 seconds. And then I'll let Dave share his answer, because frankly, Dave, I gave you an answer, but I'm unsure of it. So I'm going to give you the mic back on the answer.
This was a little bit of maybe a sneaky question.
It was.
So thankfully you don't get graded on this. So this is good.
No. And by the way, guys, before Dave gives the answer, and I think I was right, by the way, Dave, just what he just said. Okay, yes. Okay. Well, then I'll say it. It's false. It's false, guys. Yeah. So go ahead, Dave. I'll let you add some context behind that.
Yeah, I did sort of stress the importance of PTSD and that it's a high rate, but it's not a majority. It's not a majority. It's about a third. Right.
Okay.
So that was a little sneaky on my part.
No, that's good. No, and very good, everybody. And by the way, everybody got a complete on poll question 1, since Robbie forgot to put it in, and then we've got the third one ready to go. So back to you, Dave.
Was there a question? I thought there was a question, Maria.
Yeah, I think Maria had a question. I can go to it here. Let me go to. We've got a few. Oh,
that might have been
she. You know what? Marie was answering. She might have. Let me see. She might have been answering the poll question. Yeah, I believe so, because she had put, she had asked before if it was cross addiction. Dave, I think you did address that before.
Yeah.
Yeah, but then the last question I have, I think she was just answering one of the poll questions. So, okay.
Well, we're at 1:52, so let me just go for about 3 or 4 more minutes, and then I'm going to stop and ask for any questions, okay?
Sounds good.
So maybe, Robbie, I don't know if you want to just virtually throw something at me when I get to that point. Just interrupt and...
No worries.
I'll try and watch the time.
Yeah, about 3 more minutes, Dave. Is that right?
That'd be great. Yeah.
Okay, perfect.
So,
okay.
Now, was going to talk about how do we treat gambling and co-occurring issues, and I want to think about a few issues here in relation to a case. And this case is actually an amalgamation of some of my cases I've had over the years, and also adapting some stuff from Tip 42, which is the CSAT and SAMHSA tip module on treating co-occurring disorders. And when I do this sort of case, just want you all to think about, what are the crisis clinical issues? Are there any legal or ethical issues, diagnostic issues? What would your treatment plan be, and so forth. We won't have a discussion unless we kind of get there, but this is Maria. Maria is a 38-year-old woman who's a mother of 2 teenage daughters. She presents with an 11-year history of alcohol abuse and a history of trauma and PTSD related to a long-standing abusive relationship, now over for 6 years. She is not in an intimate relationship at present. There is no current indication that she is at any risk for either violence or self-harm. She also has persistent major depression and panic treated with antidepressants. She is quite ambivalent about her gambling and alcohol use. Her gambling is escalated to 5 times per week. She is spending about $100 each time she goes to the casino. She drinks about half a pint of liquor daily. And of course, you guys can think about, that's about, I think that was about 13 drinks. She does not believe her gambling or drinking are adversely affecting her parenting, but there have been several evenings when Maria has suggested her younger daughter stay with a friend who could go to so she could go to the casino. Currently, Maria is in debt because of her gambling and recently lost her job as an auditor at a local college. She reports that drinking and gambling help her to relax and that she loses track of time when she's at the casino. Maria is ambivalent about her gambling and drinking, at sometimes feeling these to be harmless indulgences, and at others feeling like they are leading her to ruin. She has come to therapy because her current money situation has led to an exacerbation of her depression and anxiety symptoms. So when we think about this, there are a lot of things to consider. One is, are there any crisis or clinical issues? Well, there are certainly a lot of clinical issues. There may be some crisis issues if she was experiencing suicidal ideation, which is something we didn't really talk about there. It's important to address the safety of the teenage daughter and whether or not that child's being neglected. There are a lot of clinical issues around her ambivalence, around the alcohol use, around the loss of her job, loss of structure, the bereavement she may be experiencing, and many other sort of aspects to that. So this is sort of why this is a good example of a case, because it doesn't just involve the gambling, and it doesn't just involve the anxiety and the PTSD and the alcohol use, but it involves all of the other life things that may sort of go with it, like her parenting practices, like the fact that she's stressed out that she lost her job, like that she's going to have problems supporting herself and paying her rent, and that all of these things may be coming together to lead to an escalation of these symptoms. So these are all things that we have to consider, and this is not an atypical case that we might experience when we're treating people with gambling problems. One of the models that I really like to sort of think about is a model that was
5 minutes, Dave.
Okay, give me one more minute. I just want to
no
present
worries.
this,
Just want to let you know.
We'll
Okay.
stop. Thank you. This is a model by Alan Marlatt, who created relapse prevention as a cognitive behavioral treatment, and his mentee, Katie Witzkowitz at the time. And he was focused on relapse and a cognitive model of relapse. And what he basically came up with was this. If people are experiencing a high-risk situation, high risk for relapse, but they have effective coping responses, strategies, that will lead to an increased sense of self-efficacy, a belief that they can get through this, and it will decrease the chance of relapse. So that's that top arm of the model there. If a person experiences a high-risk situation, but they don't cope effectively, and also they experience a lot of thoughts, emotions, reactions, and triggers related to trauma, related to other things around addiction, that may result in an ineffective coping strategy. It will decrease their self-efficacy, it will increase their positive outcome expectancies around gambling, and it will lead to initial gambling, which may lead to what we call an abstinence violation effect, or a technical term to say, I just blew it, which increases the probability of relapse. So one of the most important things that I think we can do in terms of our clinical work is help to increase people's effective coping responses, especially in light of mental health problems. It's also important to treat the mental health and the gambling together, not just one or the other. So let me just stop there, and we have a third question, but I think maybe we can open it up to the audience questions. What do you think?
I'm sorry, Dave. I'm back.
Okay.
Yeah.
yeah.
It doesn't matter. We can launch it, or we can just go into the questions. You want to just go into the questions?
Sure.
Yeah,
sure.
we can do that. Yeah. Okay. All right.
So maybe if you want to unmute people, they could just.
Sure. Yeah. Let's maybe we'll start with the chats. Okay. Let's see here. It's all about they're all answering our
all the polls.
Yes, all the polls. Yes, they
if
are.
anyone does have a question, if you want to type it in there, that'd
Sure.
be fine. Or
let me go to the questions now too. So I'm looking over the questions as well. The only question we have, are you suggesting a cross addiction? So you know what? Yeah. Maybe we launch this last one and I'll look for questions as we launch it. Is that
Sure.
okay? Okay.
Yeah.
So here's our last and final poll question. which asks, which of the following statements are true? We don't have accurate estimates for how many people with gambling disorder die by suicide. B, gambling disorder is thought to be thought by many to be an addiction. C, as many as fourfold more people with gambling problems have daily cigarette smokers compared with the general population. Or is it D, all the above? So which of these are true? We don't have accurate estimates for how many people with gambling disorder eventually die by suicide. Or B, gambling disorder is thought by many to be an addiction. Or C, as many as fourfold more people with gambling problems are daily cigarette smokers compared with the general population. Or all of these true, D. And we've got about 60%, T minus 5 seconds. And it's D, all the above is true.
Right.
And I'll
Yeah, I
hand it
made that
back
one
over
a
to you,
little
David.
easy.
That one was.
Right. So, this might be a challenging kind of venue to do questions. If anyone does have any questions for me, my email is on this last slide. I'd be happy to answer any questions you might have. Obviously, I am not at that phone number until they let me back in the United States. So, just so you know.
Yeah, and very good. And
It's
I tell
not
you,
forever.
for those of you, we're at the hour, so if you have to log off, thank you for logging on. I do have a couple questions, Dave, if you have a couple of minutes
Okay,
after we
yeah,
did. Yeah.
absolutely.
And this comes from, hey, Julie Hines, who was
Oh,
our
hey,
guest
Julie.
speaker last week or a couple weeks ago. I'm curious if you have any thoughts about how those with gambling disorder who are in recovery from substance use disorders, such as alcohol use disorder, might be affected by COVID-19 due to the lack of gambling opportunities. Great question, Julie. Yes.
Yeah, it's disrupting everybody, right? I I know where I live in the Windsor and Detroit areas, the casinos are closed, and that's true, I think, almost everywhere now. I have to think that unless people have sort of a pipeline to do sort of illegal gambling, or they have engaged in other forms of unregulated gambling before, a lot of people are probably experiencing a time where they really can't do much gambling. I mean, they could potentially play lottery or do other things that might still be available. I suppose it's possible that it might be driving some people to some online gaming. For example, I know in Michigan, the lottery has an online platform,
Right.
but I don't have any data to suggest that any of that is happening yet.
Right.
And I haven't seen any just yet to see if people are moving to other forms of gambling or if people are just taking a break.
Okay,
You know?
yeah, and no, that was a great question, and I do want to say, Dave, you were talking about factors associated with, suicide, and
Hmm.
one of it, isolation was one, and I read an
Yeah.
article. Now, this isn't in about gambling so much as it is suicide, because I'm writing our next piece as we speak on the that we're doing on the 21st about suicide.
Hmm.
There was a case of someone in the UK with bipolar disorder that unfortunately took his life. So I'm sure with the COVID-19 and the isolation, that can come into play and become dangerous for
Yeah.
some folks. Yeah.
Well, and we do know, and I think part of Julie's question was around people who are in recovery from other substances, and we do know that major traumatic kind of societal events um, can actually contribute to a greater chance of relapse to substance use problems.
Yeah.
And we know that from data from 9/11 and from Katrina, that during those times there were higher rates of relapse to substance use problems. Uh, so some of those folks who have a co-occurring history may also be experiencing more cues and more cravings to have a drink
Yeah.
uh, or use or quit and start smoking again or whatever.
Yeah. Well, good point. And then also,
Hmm.
Colleen had a quick
Yeah.
question on the study in 2005. She might be asking about the Nessart study. Do you know what the percentage of people who smoked in 2005 was? And I don't know off the top of my head. Do you remember,
Yeah,
Dave, or do you have that slide?
higher. I don't know, but I would guesstimate it was around 20 to 25%, 20 to 25%. So
Okay.
that's a nice spot, yeah, because we shouldn't necessarily compare the rates to today's rate, because there has been yet another sort of decline in cigarette smoking in the last decade and a half. So you're probably in the range of 20 to 22% back then. So you're right; it's probably not fourfold; it's more like threefold.
Okay. And then the last thing here, Marie had emailed me this, and thank you, Marie, that she has heard that some gamblers are doing illegal gambling, reverting to illegal gambling and gambling in covert locations, different times and different places. So I don't know if there's higher levels of that, if there's any. Uh, I'm sure there's no evidence-based, studies yet, but I'm wondering with the casinos, I'm sure there's going to be all kinds of types of things coming out in studies, perhaps due to this lockdown, if you will, due to the pandemic and what folks are going to as far
Right.
as right. Yeah.
Yeah, I don't know that we have any good data yet.
Yeah.
But that might be something that would be very interesting to ask people about their experience of gambling during this time of shutdown. So what did they do?
Right.
I wonder if some people might be wary of asking people and like providing them a list of, did you do this type of gambling or this type of gambling? Because it might give people ideas to
Could
actually,
trigger them. Yeah. Right.
it's like, oh
Yeah.
yeah, that's right. Michigan has a website or
Yeah.
something like that.
Or
You don't want to
well, I
necessarily
haven't
trigger
thought of
people.
that. Yeah.
Yeah.
Yeah. Oh my. Yeah. Yeah.
Right.
Danger.
Yeah,
Yeah.
exactly.
Hey, Dave, thank you for going beyond a few minutes
Oh,
here.
no
And
worries.
my
Anytime.
apologies, guys, for, part of that was my poll questions, but we got a couple in anyway. So, and what I will say too, Dave, to your point earlier, maybe we can carve out some more time. And, with Zoom, sometimes I personally, it's kind of challenging to find the folks, especially when there are these numbers, to be able to unmute them. But maybe we
Yeah.
can take a stab at it.
Okay.
We still got some good questions here. And again,
Yeah.
thank you for the presentation and staying on for a few minutes, and all of you folks who were able to stay on for this little bit of Q&A 5 or so minutes after. So,
Yeah.
hope everybody gets to join us on April 10th. Everybody stay safe, stay put, if you will, and stay healthy. And we'll be talking soon. Thank you. And thank you again, Dave.
Thanks,
Great
Robbie,
presentation.
and thanks to everybody online. I really appreciate you being here.
Wonderful. Okay. Thank you.
Bye now.